Madam Secretary, thank you for your service, and thank you for coming here today and sharing with us on this. My name is John Barrow. I represent Savannah, Georgia, Augusta, Georgia, and all points in between. Our prior response to seasonal flu might not be the best guide for what we should do, but it's probably a pretty good guide as to what we will do unless we do something different. And I am given to understand that less than half the targeted populations we reach out to on a regular seasonal basis get the vaccine that is suited for that situation. And so we got to anticipate, unless we do something different, we're going to have sort of a similar success rate in response to this new threat. I understand that one of the targeted populations we are trying to reach in response to the H1N1 is the population of children and young adults 6 months to 24 years of age. Kind of sets it apart a little bit, perhaps, from seasonal flu. I'm having a telephone conference call this afternoon with a pretty influential bunch of folks with respect to that targeted population. My public health expert, Ms. Betty Dixon, is with me today, and she's going to be participating in this conference. We're going to be talking with every superintendent, every assistant superintendent, the principals from every elementary, middle, and high school in the district, and the deans of students at many of the 18 institutions of higher learning that we have in my district. So my question to you is sort of a general one, but what can we do? What can we say in the course of that conversation with that captive and very influential audience to help them get a higher success rate in reaching the targeted population they have some influence over than we've been able to do so far with respect to seasonal flu? What can we tell them that we're not already telling them?
Well, I think that you can tell them that we know that they have the target population, and that if it's nothing more than just lots of folks getting the flu, that has a huge disruptive factor. So minimizing the spread right now and then vaccinating, we know, is the best defense against the flu spread. We do have some great information on the website. I would suggest that maybe if you put the widget on your website and urge them to come and download, we've got parent toolkits and information for teachers.
This is how to. What can we tell them as to why to? This is how to do things. What can we tell them to motivate them to make a greater effort than has been made in the past?
Well, they can keep people from being hospitalized and dying. If 36,000 children in this country die from this flu, I would suggest it will have a huge impact on communities around the country, and that's the average death rate for seasonal flu. So even if it's just like regular flu, given the population that basically they are responsible for, that's what it looks like. And so I think you need to convince them that even the regular flu is particularly, is different because it's kids and it's young adults. They have no immunity to this whatsoever. So anybody with underlying health conditions is really at far higher risk. And I think just getting them their hands around 200,000 hospitalizations year in, year out with seasonal flu, 36,000 deaths, that's what the profile looks like. But typically, because of the age of the population who is typically affected and because of their frail condition, I'm not sure it has the kind of societal impact, community impact. There is, Dr. Shuka tells me, a new toolkit for school immunization that will be online, well, that went online on the 13th.
Available at?
But I just think, getting their attention about how even mild flu is very serious. People die, people get very sick, and anything we can do to prevent that, really, we need them to do.
Thank you.